Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Rheumatology.
So today we're learning more about rheumatoid arthritis.
And also, how to reset your weight loss approach.
I'll be off-roading.
Wow. Balancing Act starts right now.
Today we continue our four-part series on metabolic health. Approximately 70% of American adults are overweight or obese, 70%, which obviously can lead to serious health issues. And 95% of diets fail.
Allie Betts knows all too well all about this, but she's made a decision to get to the root cause of her weight gain problems.
Today we're going to find out more about the program that's helping her calibrate her weight. It's great to have you here because last time we spoke you were via Zoom.
Yes,
That's right.
Thank you for having me.
Allie, before we get started, I want to remind our viewers, and I think this is really important, what our set point is and the role it plays in weight loss. So listen to this. When traditional diets don't work, it's not because you need more willpower. It's because your body's programmed to do everything it can to maintain your current weight, called your set point. Makes sense. Set points were critical when we were hunters and gatherers. Back then, a drop in weight was a sign food was scarce and we needed to store energy. But in today's world, they're the reason you can't keep weight off with diets alone. To change your set point, you need to change your biology. Calibrate is a doctor-guided program backed by decades of academic research. It pairs prescription medicine, GLP-1s, with coaching and simple behavior changes to reset your whole metabolic system. That's really interesting.
Yeah, absolutely. Now, you've been on the Calibrate now since April?
Since April.
Tell us how it's been going.
It's fantastic. It has changed the way I feel. I love the program. It's very easy. The medication does something where it helps you. Your system, when you're full, you're done. It stops you from cravings. It helps you make better choices. I find that I don't have that fight with food anymore.
Have you noticed weight loss or?
I've noticed that my clothes fit me much better. The belt buckles are better. I walk and I don't get exhausted. I work out a lot. I kickbox. That energy is back again. I'm just not so tired where I need to gasp that air. I'm really, really good.
Hey, give us a number. How much have you lost?
I've lost 22 pounds, so about 13%.
That's great.
Yeah.
And I hear that you work a lot with your accountability coach. So how is she helping you?
She's like my workout partner. When you have a workout partner, that person makes you work a little harder. So in this regard, I am accountable to her. It's just a great program.
That's great. Well, Allie's a great example of how the program works. Accountability, food program, and as noted, the GLP-1 medications are clinically proven to help reduce body weight by, watch this, between 10 and 20%.
That's fantastic.
And there's a new development, I think, that we've just discovered, right?
That's right. U.S. Food and Drug Administration just approved Wegovy, a new GLP-1 medication for chronic weight management in adults with obesity or overweight with at least one weight-related condition. Wegovy works by mimicking a hormone called GLP-1 that targets areas of the brain that regulate appetite and food intake.
Allie, you're showing such great results. Can you, tell us a little bit about, your thoughts on the medication and how it works for you, and how are you doing?
I really don't have a fear of food anymore. If I want that half a slice of pizza, I'm going to have it. Calibrate does not tell you what to eat. I find that that's the best kind of diet. They're open to everything. However, you are accountable for what you eat. So you have to make the right choices, and that's where they come in and help you. That's where the medicine stops those cravings. It's a completely different mindset.
And you seem so optimistic.
I love it. I love this program.
Oh, that's great.
Such a great attitude. Thanks so much for being here. And look, you can check in and check your eligibility and get details on how to start your journey at joincalibrate.com.
Joincalibrate.com, or just check out our website, thebalancingact.com. Are you ready to experience the great outdoors? Of course you are. After being stuck inside for more than a year, it's time to go outside and enjoy Mother Nature. I'm here at Bow Valley ATV Park in Central Florida with Pam Kermisch, Chief Customer Engagement and Growth Officer at Polaris. She's here to guide me through all things off-roading. Good morning.
Good morning.
I am so excited, Pam.
I'm so excited to be here. So, Olga, have you ridden before?
No, I have not. But you know what? I keep hearing and reading that women and wheels, it's becoming trendy.
A lot of people think that off-roading and power sports in general is really for men. And that's simply not true. We have a ton of female customers who are riders, and it's growing because as women are looking for new ways to connect with family and friends and do things that are exciting, it's something that they're discovering and it's growing.
And I never thought I would do this. Now that I'm here, should I feel a little intimidated?
Absolutely not.
No?
I did not grow up riding, and I've taken my parents in their 70s. I've taken my friends and their teenage daughters riding. All of them have driven and they had no prior riding experience. So at the end of the day, it should feel familiar. There's a steering wheel, there's a seat belt, there's a gas pedal and a brake pedal. And the most important thing is you ride to your level.
Pam, your motto is think outside. I love that. And we recently just celebrated National Get Outdoors Day. Today's a beautiful day, but really every day is a great day, right?
Any day is a great day to ride. So during the pandemic, people found that in the outdoors, that was their escape, that was their fun. And so even as things are opening up now, they're looking to the outdoors to continue to have fun and escape. Riding and off-roading is a great way to do that, and that's what we're gonna do today.
All right, so I'm ready. Can we go for a ride?
Absolutely.
Okay, I got my jersey on.
Looks great.
I know!
Put the helmet on.
Alrighty. Oh, wow, this thing is big.
The next step is gonna be to put our gloves on.
All right. Oh my gosh, this is too cool. Wait, let's do a selfie before we get started.
Awesome.
Ready? 3, 2, 1. All right, so tell me about this baby.
This is a Polaris RZR. It's a side-by-side. So if you think about it, we're sitting side-by-side with your passenger.
Makes sense.
It comes in 2-seat and 4-seat options, and the 4-seater is really great for families. We also make utility side-by-sides that a lot of people use to do work on their property. But the Polaris RZR was created for recreational fun riding, and that's what we're gonna do today.
Okay, I'm ready to have some fun.
Great, let's get our seatbelts on. You hang on right here, and let's go.
Let's do it. Woo!
I'm so glad you had fun. That was awesome.
That was a great time. What a fantastic experience. Oh my gosh. All right, so fill me in a little bit more about the company, its history.
Absolutely. So Polaris was founded in 1954 when two brothers and a best friend attached a motor to a sled to create the very first snowmobile.
Aww.
So now, all these years later, we have over 30 brands that help people connect to the outdoors. So you can ride across a ton of different terrain. Snow, water, mud, sand, you name it.
So how can people experience all of this?
We have 160 Polaris Adventures locations throughout the United States, where you can rent a RZR or a 3-wheeled slingshot for on-road riding for 2 hours for a full day, etc. This summer, when families are looking for something fun to do, it's a great way to get outdoors and try something you've never done.
Absolutely. I mean, I would tell everybody out there, do this. So for our viewers who'd like more information, where can they go?
The Polaris Adventures website is a great place to start.
Okay, thank you so much for everything. I had a wonderful time. And of course, for our viewers, if you'd like more information about any of this, thebalancingact.com.
Thank you.
One more spin before I go back home?
Absolutely. Let's go.
Let's go. I gotta do this at least one more time, right? Wait,
absolutely.
What if I drive now?
Let's do it.
Let's do it. Let's switch it up. Rheumatoid arthritis, or RA, is a systematic chronic inflammatory disease that affects the joints. If not managed effectively, it can get progressively worse. We start with Shirley, whose life was impacted by this disease.
Starting my day with RA is usually difficult. I felt stiff and I struggled to get going, and that affected the rest of my day, and it just took longer to do everything. RA affects my hip, knees, shoulder, elbow, feet, and my hands. I love to sew, but my hands were stiff and painful, and it made it very difficult.
The Balancing Act is on location at the Rheumatology Associates of Oklahoma to learn more from rheumatologist Dr. Latisha Heinlen.
Rheumatoid arthritis is an autoimmune disease, which means your immune system is attacking your own body. And in this disease, it's actually attacking your joints. It's a systemic disorder with inflammation throughout the body, and various tissues can be affected. Some of the joints affected include the hands, the shoulders, the feet, hips, knees, and wrists. Patients experience pain, aches, tenderness, swelling, and morning stiffness. These symptoms often occur on both sides of the body, so it could affect both knees or both hands, for example.
More than 80% of rheumatoid arthritis patients may already have joint damage within 2 years of disease onset. In fact, progressive joint damage may lead to other health problems if left untreated.
Our goal as rheumatologists is remission or low disease activity. If your current therapy is not effective or if your RA is progressing, you may need to add another treatment option or switch to a different medication.
There are several treatment options available. Those aim to relieve symptoms like pain relievers or steroids, and DMARDs, which are disease-modifying anti-rheumatic drugs which target the underlying cause of this disease.
I've been on multiple therapies through the years. I had some relief at first, and then it wouldn't work as well. I have a great relationship with my doctor, so there's a lot of communication if I'm flaring, swelling, and pain. I've always believed in trying new and different therapies and take an active role in my health.
While there is no cure for RA, it is possible to slow or stop the progression. Patients have seen improvements in their symptoms by targeting pro-inflammatory cytokine pathways, such as TNF, JAK, and IL-6, which play a critical role in RA disease progression.
A majority of patients with active RA have elevated IL-6 levels, which plays a central role in inflammatory pathways that may lead to chronic inflammation, disease progression, joint destruction, and systemic manifestations, including pain and morning stiffness. Kevzara is a prescription biologic that helps correct elevated IL-6 levels in adult patients with moderately to severely active RA.
Kevzara sarilumab can lower the ability of your immune system to fight infections. Serious and sometimes fatal infections, including tuberculosis, have happened, as have changes in lab results, tears in the stomach or intestines, and certain cancers. Tell your doctor if you've been somewhere fungal infections are common, or if you've had TB, hepatitis, or are prone to infections. Don't start Kevzara if you have an infection.
Studies have shown that patients who used Kevzara saw an improvement in their symptoms, such as pain, swollen joints, and stiffness. It also improved the ability to perform everyday activities. Kevzara takes an approach that is different than many other approved therapies and may work when others have not.
I heard about Kevzara. I contacted my physician and we talked about it. And 2 days later, I got the prescription. With Kevzara, I felt that I could do a lot of the things that I didn't think I'd ever be able to do again. I feel less pain and stiffness in the mornings, and I can go days without feeling tired.
It's important to know there are many ways to manage the disease and get back to the life you've lived. Patients should not settle with feeling good enough.
My advice to anyone with RA is you cannot give up on yourself. If you do nothing, this disease can be very aggressive. I'm going to do everything I can to make sure this disease does not define me.
It's so great to see Shirley doing well. For full prescribing information, visit Kevzara.com and stay tuned for important safety information. As always, you can visit our website, thebalancingact.com. We'll be right back. Important safety information. Kevzara can cause serious side effects, including serious infections. Kevzara is a medicine that affects your immune system. Kevzara can lower the ability of your immune system to fight infections. Some people have had serious infections while using Kevzara, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have died from these infections. Your healthcare provider should test you for TB before starting Kevzara. Your healthcare provider should monitor you closely for signs and symptoms of TB during treatment with Kevzara. Before
Before starting Kevzara, tell your healthcare provider if you think you have an infection or have symptoms of an infection with or without a fever. Symptoms may include sweats or chills, muscle aches, a cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than normal. If you feel very tired or if you've been treated for an infection, get a lot of infections or have repeated infections, have diabetes, HIV, or a weakened immune system, have TB or have been in close contact with someone with TB, live or have lived or have traveled to certain parts of the country such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance of getting certain fungal infections, histoplasmosis, coccidioidomycosis, or blastomycosis, have or have had hepatitis. After starting Kevzara, call your healthcare provider right away if you have any symptom of an infection. Changes in certain laboratory test results. Your healthcare provider should do blood tests before and after starting Kevzara to check for low neutrophil, white blood cells that help the body fight off bacterial infections, counts. Low platelet, blood cells that help with blood clotting and stop bleeding, counts. And an increase in certain liver function tests. Changes in test results are common with Kevzara and can be severe. You may also have changes in other laboratory tests, such as your blood cholesterol levels. Your healthcare provider should do blood tests 4 to 8 weeks after starting Kevzara, and then every 6 months during treatment to check for an increase in blood cholesterol levels. Tears, perforation of the stomach or intestines. Tell your healthcare provider if you've had a condition known as diverticulitis, inflammation in parts of the large intestine, or ulcers in your stomach or intestines. Some people using Kevzara had tears in their stomach or intestine. This happens most often in people who also take non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, or methotrexate. Call your healthcare provider right away if you have a fever and stomach abdominal pain that does not go away. Cancer. Kevzara may increase your risk of certain cancers by changing the way your immune system works. Tell your healthcare provider if you have ever had any type of cancer. Serious allergic reactions. Serious allergic reactions can happen with Kevzara. Get medical attention right away if you have any of the following signs: shortness of breath or trouble breathing, feeling dizzy or faint, swelling of your lips, tongue, or face, moderate or severe stomach, abdominal pain, or vomiting or chest pain. Do not use Kevzara if you're allergic to sarilumab or any of the ingredients of Kevzara. Before using Kevzara, tell your healthcare provider if you have an infection, have liver problems, have had stomach abdominal pain, or a condition known as diverticulitis, inflammation in parts of the large intestine, or ulcers in your stomach or intestines. Recently received or are scheduled to receive a vaccine. People who take Kevzara should not receive live vaccines. Plan to have surgery or a medical procedure. Are pregnant or plan to become pregnant. It is not known if Kevzara will harm your unborn baby. Are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby if you use Kevzara. It is not known if Kevzara passes into your breast milk. Take any prescription or non-prescription medicines, vitamins, or herbal supplements. It is especially important to tell your healthcare provider if you use any other medicines to treat your RA. Using Kevzara with these medicines may increase your risk of infection. Medicines that affect the way certain liver enzymes work. Ask your healthcare provider if you are not sure if your medicine is one of these. The most common side effects include injection site redness, upper respiratory tract infection, urinary tract infection, nasal congestion, sore throat, and runny nose. These are not all the possible side effects of Kevzara. Tell your doctor about any side effect that bothers you or does not go away. You're encouraged to report side effects of prescription drugs to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. To learn more, talk about Kevzara with your healthcare provider or pharmacist. The FDA-approved medication guide and prescribing information can be found at Kevzara.com or by calling 1-844-KEVZARA. That's 1-844-538-9272.
Thanks so much for joining us today.
Remember to head to our Facebook page and our website and follow us on Twitter.
And of course, be safe, take care of that family of yours. We'll see you next time.